Autism is actually a spectrum, so we refer to it as autism spectrum disorders, and it presents in a variety of different ways, really unique to each individual child. But overall, it's an issue with how kids relate to others. So it has to do with their social skills and their ability to bring their world into others' lives and bring others' worlds into theirs. There are a lot of children who might be shy, but they still are able to identify that there's certain people or individuals that they really do rely on and they really do want to interact with. I always recommend that if parents have concerns, they bring it up early to their pediatricians because that's going to be the best way for the pediatrician to go through numerous questions and really get a better sense of what might be going on. Usually around 18 months is our typical age to start screening. Despite a lot of research on the topic, we still don't have a whole lot of answers as to what the cause of autism is at the end of the day. So there certainly are more kids being diagnosed with autism, and the reasons for that are probably multifactorial. So the one is that we have in some ways adjusted how we define autism. So with a better awareness and better understanding of all of the components of autism, I think that pediatricians in general are better at diagnosing it. So kids who may not have had that specific diagnosis in the past may be given an answer. So in the past there was probably a lot of frustrated families who didn't really understand everything that was going on with their child and now might have a better explanation. So we have certainly increased our awareness and identification. I also think that there may be a tendency towards an increase overall in the general population. Early intervention is definitely found to be the most effective way that we can help treat kids when they are identified as having autism. So certainly the sooner we can get some of these therapies going, the more it improves their long-term course. It is not necessarily that individuals who have autism are going to grow up and per se grow out of it, but what often happens is kids, especially if they're on a more mild end of the spectrum, might learn a lot of techniques and strategies for when they're dealing with public settings and interacting with others so that they really learn how to present themselves in a way that helps to maximize their ability to interact with their environment.